You ever wondered why your CPD evidence isn't enough, or it comes back unsuccessful, or you're confused about what annotation is? Well, don't look any further. In this video, I'll be explaining what annotation is and how to annotate your evidence. I will be explaining how to tell a good story. So what is evidence annotation? Annotations are explanatory notes which are added to your evidence. It provides context, it explains what the evidence shows, and it links to the specific behavioral statement it addresses. The purpose of evidence is to tell a good story behind your evidence. Why is evidence annotation important? Evidence annotation shows understanding of the activity done. It is proof that the story actually happened. It links to the overall CPT activity that you conducted, and it's a demonstration of the skill that you obtained in the activity. Without annotation, your evidence is just paper. It doesn't tell any good story. So this is a guide on what good evidence is supposed to include. This is not cast in stone. It's just what I've observed over the years while working with interns who are annotating their evidence. Your your annotation should have a clear title of the evidence that you're including. It should contain a description of what it shows. It should link to the specific behavioral statement that you're trying to address, or maybe it's two behavioral statements that you're trying to address. So it should link to that. Your annotation explains how it relates to the behavioral statements, and it should be neat. It should be neatly written, and the label should be clearly indicating what the evidence shows. Common mistakes that I've observed while working with interns. Some interns will include ambiguous evidence. It will be titled A, B, C without any explanation as to what the evidence shows, what the story is about. There's no title, there's nothing, just ambiguous titles there. That's not good enough. Some common mistakes I've seen is that interns would write C attached or as pieces of evidence, just papers, and then C attached, thinking that they've provided enough evidence. And that's not okay. I've seen that some would not include explanation of what the evidence is, what it includes, and how it relates to the behavioral statements. Sometimes they would use a blanket evidence, so that means an evidence that covers multiple behavioral statements. You'd find that in annotations, it would be written linked to behavioral statement A, B, C, D, and E. And when you're looking at the work, you're thinking, it sounds very fishy, but okay. And you'll see that sometimes there isn't a clear link on the behavioral statement or to the behavioral statement, which makes it tricky to understand if the intern actually understood the work that they're doing. This slide, I will be explaining what is meaningless evidence, so insufficiently annotated pieces of documents that an intern can attach as evidence. Here, as you can see, we have a prescription from a doctor. Okay, it's a good prescription. We can see that it is transferred as the original document. And yeah, it's a prescription for a Schedule 6 from what we can see on that prescription. And then an intern is annotating the evidence. They're saying that this is evidence 1. This is the prescription that I evaluated correctly. So we can see it's a prescription and it's something that you evaluated, but it doesn't tell enough of a story to be deemed as sufficiently annotated. One of the checklists that I've developed, as you can see here, is that your evidence should contain a title. Okay, in this evidence, we can see that there's a title, it's evidence 1. It's clearly, clearly labeled to demarcate, to differentiate that there's different, evidences that will be included. And this is the first evidence that I'm going to include. It shows, it demonstrates what the evidence shows. So we can see from this intern that, this is a prescription that they evaluated correctly. But when was this done? And how does this link to the activity that is being done? And how does this link to the behavioral statement that is being addressed? You can see it's a prescription and that you evaluated, but as a friend, and if you're telling me a story and this is all that you provided, I'm thinking, there's a story missing. So we need to hear more of the details. How did you do it? When did it happen? Where did it happen? This is what annotation is. It's like a show and tell. Tell me more. It's like talking to a friend and you're telling your friend that this is evidence 1 and this is a prescription that you evaluated correctly. As a friend, I'd be thinking, man, there's something missing in this story. Tell me more. This is an example of how you can annotate your evidence if you are providing the prescription, as you can see. So now we can see that there's an expansion on the annotations that this intern provided. There's a clearly labeled title, so it's evidence 1, and then they are starting their story. This is a prescription I evaluated according to Regulation 33 of the Medicines and Related Substance Control Act. Interesting. Okay. How did you do it? I checked and saw that the prescription contained the patient's name, the address, the contact numbers on the prescription, and then this is linked to a specific behavioral statement. Okay. I checked and saw that the instructions for the administration, the approved drug name, the strength, dosing, frequency, route of administration, and the treatment duration is also included. Since this is a Schedule 6, the quantity was written in words and figures. So this is linked to behavioral statement X. And then I go and I check and I see this information. So you see here, I have a better story. I understand what's going on. But this intern did not end there because this intern understands the art of storytelling. So they go on. On your top right corner, you can see that they are stating the prescription was presented for dispensing on the 8th of November 2024, which is within the 30-day period according to Section 22A of the Medicines and Related Substance Control Act. It was written on the 8th of November 2024, so it's valid. Okay, I understand that this intern has an understanding that according to Regulation 22A of the Medicines and Related Substance Control Act, a prescription is to be presented within 30 days of it being written, and they are explaining this, linking it with the act. So now this is better annotation, as you can see. And then they go on your right, the middle box there. According to Regulation 33 of the Medicines and Related Substance Control Act, the prescription also contained the surname, initial, signature. I also checked and I saw that the prescription contained these details linked to behavioral statement X. So on this annotation, I can see that they are telling a better story. I understand what's going on. I have a better clue of what they are doing here in this prescription. So this makes better sense. So on the checklist that I included, I stated that there's a title that's provided. I also saw that it shows what this prescription shows. It's Regulation 33. They are evaluating a prescription and then they're using specific sections of a regulation to evaluate the legality and the validity of the prescription. So it's good. It's good. So how does this link with the activity? So they've already stated that according to this act or the overall activity, they're supposed to evaluate the legality of a prescription, which they did. And then they also explain with the relevant act. So this is way better. This is another example of when we're annotating a picture. Okay, so there's evidence, it's evidence 1, so there's a nice title over there. The patient demonstrating how to use the inhaler, linked to behavioral statement C. As a friend, I'm sure you have a friend. If your friend just told you this and that's the end of the story, it's not enough. What are the details? Where did it happen? How does this link to the overall activity? Tell me more. So this is what annotation is. It's telling a good story. So in the evidence that you provide, you are a storyteller. So you need to learn the art. This is a way better story that they are telling. Okay, I can see that this is evidence 1. The patient is demonstrating how to use the inhaler. This is linked to behavioral statement C. And then they are explaining, they're telling more of the story that they're doing. After demonstrating how to use the inhaler, I wanted to obtain feedback and gauge the understanding of, the patient use of the inhaler. So I gave the inhaler to the patient and asked them to show me how to use it according to the guide I provided. I watched each step carefully and saw that the patient understood how to use the inhaler directly. So now I understand. There's a title. What does it show? It's a patient who was given an inhaler and then they're obtaining feedback by giving the patient the inhaler to demonstrate. When was this done? Okay, now there is a sequence in their activities. After demonstrating, so they demonstrated something and then they wanted to obtain feedback. So that means they demonstrated and then they gave. So there's a sequence in the activities that they did. How does it link to the activity? According to the activity, they needed to counsel the patient and then obtain feedback on how the patient understands, the counseling session that was provided. And then this is linked to a specific behavioral statement that they are addressing. So this again is a better story. Again, here we've got not so good annotation, but let's see what they are saying. So this is evidence 1 again, and then they are including a section of the GPP manual, which is section 2.18, which they familiarize themselves with, and it's linked to a specific behavioral statement. There's a title, evidence 1, and they're stating what this shows, section 2.18 of the GPP, and they familiarize themselves with it. But why? When was this done, and how does it link to the activity that they are doing? And the link to the behavior statement, at least it's included, it's behavior statement C. But there isn't enough information to understand what the story is about. So let's see how they can improve it. This is way better annotation that they provided. Again, annotation is the art of storytelling. So now they are stating that this is evidence 1. This is section 2.18 of the GPP manual, which I familiarize myself with to ensure I know the compounding standards for compounding the cream. And then this is linked to a specific behavior statement. Okay, so how did you do it? I washed my hands with an antiseptic soap and water and dried them using a paper towel. Before compounding the cream, I wore gloves, an apron, a hairnet to ensure I don't contaminate the compounded cream. So this is on the box that's on the bottom left side of the screen. Then on the top right side of the screen, they are continuing with the annotation. I compounded the cream under direct supervision of a pharmacist according to a signed, valid, and authorized SOP. Before compounding could begin, I cleaned the compounding surface with 70% alcohol and washed the equipment I would use. So now there's a title, evidence 1. What does it show? It's section 2.18 of the GPP manual, and they're stating exactly why they consulted this piece of evidence. And how does this link to the evidence? Now they are compounding, but before they could compound, they needed to understand the compounding guidelines and standards, so which is why they then included this. This is a better story because it contains all the elements that are included on the checklist down there, as you can see. But it's way better. It's way better than the one that they included before. So this is a much better story. I'm sure you agree. Yeah. This is another example. Your friend wants to tell you another story. Okay. You be the judge of this. Okay. You can comment down below and let me know if this is a good story. If this was your friend, would you be happy with the information that they are providing to you? Okay, let's go. This is evidence 1. This is section N06 from the SAMF, which I familiarized myself with. Pom, pom, pom. So your friend is telling you a story, but this is all the information that they provided. Okay, they gave you a title. They told you what it shows, but when was this done? How does it link to the activity? And all of those things. As a friend, I'm sure that you are frustrated because your friend is not telling you a good enough story. So yeah, again, I don't know how to stress this enough. Evidence annotation is the art of storytelling. How would you tell your friend a story? It's a show and tell. So get creative. Use the language, expand on what you're doing so that there's an understanding that as a friend, as I'm reading this, I'm across town and I don't have airtime, I don't have all of these things, but I'm reading your text and I'm thinking, wow, this is a good story. Or, wow, this could be a better story. Your friend writes back and says, I'm sorry, friend. I'm sorry, the story that I told you before isn't enough, but let me tell you a better story. So now the friend says, this is evidence 1, friend. This is section N06 from the SAMF SISAMF. And the 13th edition, this is page 147, which I consulted to develop the learning material. This is linked to behavior statement C. Okay, interesting. And then they continue. Before developing the learning material, I went through this section of the SAMF and learned about the various antidepressants used in the treatment of depression. I noted down their specific indications, the side effects, maximum daily doses, and the various formulations available in South Africa. Then I created the PowerPoint presentation for the trainee. By now, you're like, friend, I need more of this story. What else happened? But already you can understand what's going on. There's a title, there's what this evidence shows. It's a piece of document that's included, and then there's an edition of the document. So whenever you are using like scientific evidence, it's always best to include the section, the page numbers, the edition, and then you state what this is about. What's going on here? Because I'm only seeing pictures. Does it mean that you are able to take pictures or what's going on? So as a friend, I want to know all of this information. So now, as you're annotating your evidence, think of annotation as telling a story to your friend. What would your friend like to hear? Okay, maybe your friend, maybe not your friend, but someone, someone you would want to tell a story to. I'm saying this because please use professional language whenever you're addressing this. You're speaking to someone who's going to mark your work. But let's say that your friend likes formal professional English. How would you do it? So this is the art of storytelling. Finally, let me just give you some guidance on how you can annotate a piece of evidence whenever you've got more than one behavioral statement that you address. I normally suggest that you don't address more than two or three behavioral statements in one, activity. Or let's say, let's not do five. That's pushing it. So you can try one or two, or maybe at most three. But if you're able to clearly identify which specific section addressed which part of the evidence or the behavioral statement that you're doing. So again, this is the prescription that we included before. Okay, so this is evidence one. This is the prescription I evaluated according to regulation 33 of the MRSA. But your friend already told you this, okay? They're now explaining exactly which part of the CPD this specific behavioral statements link to. So on your left in the middle box it says I checked and saw that the prescription contained the patient's name, the address and contact numbers on this prescription. This is linked to behavioral statement A. Interesting. And then they go on to explain, I checked and saw the instructions for the administration, the approved name, the strength, dosing, frequency, and route of administration, and the treatment duration is also included. Since this is Schedule 6, the quantity was written in words and figures. So now this is linked to behavioral statement A. Okay, interesting. Now, on the right side on the top box, they are also stating that according to ethics, I need to maintain patient confidentiality. For the purpose of this CPD activity, I covered the patient's details. Now I understand, and this is linked to a different behavioral statement. The box in the middle is linked to behavioral statement A. But as you can see on this one, okay, don't mind the checklist. I was supposed to update it, but I think you get the nuance of what I'm trying to communicate here. Evidence annotation is the art of storytelling. How would you tell your friend a story? What details would they want to hear? When you're annotating more than one behavioral statement, how do you do it? Again, this is not information cast in stone. This is just supposed to provide guidance on how you can do it. You are free to freestyle and then add information, but I always suggest that here in the annotation of evidence, add as much juice to the story that you're telling. Give me the tea. I want to hear everything that you want to say in your annotation. I hope this guide helps, and thank you so much for tuning in this video on how to annotate evidence and the art of storytelling. I hope it helps.